Prof, I do like to ask though, do individuals have natural immunity to COVID-19? Are there any, individuals or people like that?
Well, so I think this has not been clearly demonstrated, but based on what we are seeing in sub-Saharan Africa, we think that there's some level of protection that we have.
Some say it's the weather.
I wouldn't say it's natural. Because
some say it's the weather because in the global north, it's winter.
Yeah.
And so maybe that's why they're having more.
The weather could be part of it. But I think it's more than the weather. I think it's our previous exposure to other pathogens. So in that case, we wouldn't say it's natural per se as in we're born with it, because there are Africans in European countries that are dying from the disease. So it's not something that we're born with. It's probably something in the environment. And that could be partly weather, because the weather definitely, the colder weather favors the spread of the virus more. But in my opinion, I think that it's our previous exposure to other pathogens which has conditioned us to be able to tolerate. And it's not that we are not getting infected, like we've said. Based on our research, 47.5% on average nationwide have been exposed. I mean, people in public places. Yeah. So let me give that caveat. Okay. Because we targeted people in public places.
People in public places who've been exposed.
So markets, shopping malls, churches, schools, and so people we didn't go to people's homes to test them. We tested people who are out there, who are economically active and mobile and all that. And nation 47.5, they've been exposed. So we are getting infected, all right, but we're not getting severely sick. And I think that is probably because we've been conditioned by the barrage of pathogens we're exposed to as we grow up in this environment.
So the body has built up some level of
resistance.
Immunity. Resistance is a better word. Okay.
Because it's not necessarily immunity. If you say immunity, it's as if
we don't get it.
Yeah, and also it's not that we have some specific mechanism for fighting it. What I think is that we've learned how to tolerate a certain range of pathogens. So I think it's more of we're tolerating it. Okay. It's not that we are not getting infected, but we're tolerating it better. So when we get it, we don't get as sick and we don't die from it. But we're getting it. But the risk is that we don't know the long-term effects of this. Like my colleague
I think that was a question he posed to you. He wanted to know what.
So we don't know the long-term effects of the vaccine, but we don't also know the long-term effects of the disease itself. So which one do you choose? Okay, you don't want to take the vaccine because you don't know the long-term effects. So you want to get a disease. Do you know the long-term effects of the disease? You don't know. Which one is worse? I think the disease is worse in this case because the disease causes so much disruption in your system, even if you are not feeling sick. The vaccine is something that's well refined. And by the way, when people say that we don't know what it's doing to you, we know what is in the vaccine. It's not a secret what is in the formulation. You understand? It's not as if they put some chemicals together. We don't know what they are. We know what is inside. We know the composition, and we know what each of those things that are in the vaccine, what they do to us. There are things we've been using for other vaccines for a long time. You understand? So what is in there is part of the vaccine plus a lot of other things which we put in other vaccines anyway. So if you are saying that you don't know the long-term effects of the vaccine, I don't think it's actually accurate because what is in there, apart from the pathogen piece, the rest of the composition is something we've been using for other vaccines already. So we know what that will do in the long term. What we don't know about is the piece of the pathogen. And if you are worried about a small piece of the pathogen in the vaccine, what about getting the whole pathogen and many of them into your system? So to make the argument that we don't know the long-term effect of the vaccine, I really don't think it's here or there because what about the long-term effects of the pathogen itself, which we are getting, which half of us have already been exposed to? And Omicron is coming. We don't have the immunity that we have would protect us partly, but not completely because it's a variant that's different from what we have been exposed to. Most of us have been exposed to Delta.